Hi everyone, welcome to Dr. Chan's Minor Ailments Forum. I just want to do a short video to let you know that I've recently started a training for acupuncture. Yay, how exciting! So I just want to let you know what I've recently learned and how I'm going to use these skills on my patients. But before I try it on my patients, I think I'll try it on my husband first, just making sure that he's okay with it. Then I'll just kind of branch it out. You need to practice after all. So the acupuncture that I've learned basically is 2 weekends course. So I've only done the first part of the weekend, so there'll be another set of weekend coming up in a few weeks time. But in the first weekend we learned quite a lot actually. We learned about several points that we're going to put needles on, especially in the arms, leg and shoulders and buttocks. And I must say it's an eye-opener because I've seen it, people doing acupunctures on TV, but I've never seen it in real, and I never knew how it actually works. And I realized that the kind of style that I used to know is actually the Chinese traditional acupuncture, which they treat you as a whole, like they treat you holistically, not just because you've got a knee pain they put the needles around the knees and make you feel better, but they actually follow the different meridians. So along a meridians, it could be a line but with different acupuncture points. So let's say if you've got a headache, then they'll put it in several points, not necessarily in your head. That's the interesting thing about it. And you can actually use acupuncture to treat your whole body with any ailments that you can think about. But that's the Chinese version, which I'm still needing to explore a little bit more, because the acupuncture that I learned is actually the Western style. And the Western style, the difference is it's mainly putting on the trigger points. For example, if you've got a shoulder pain, they'll examine to see which point is tender, and they normally put a needle in there to ease the pain. And they don't do it holistically, but mainly for pain control. And I've learned that it's actually quite good for let's say people who are pregnant, or during intrapartum when they're giving birth. I've seen quite a few midwives turning to the course, and they are actually using acupuncture in labor, which is interesting. I never knew before. So that's another area for me to kind of look into. But I just want to show you a picture of how many nerve points there are in our body. I'm just going to show you our bodies. I'm not even going to get into detail about ears, because there are loads of points in the ears as well. So I hope that you can see it all right. So look, these are all the nerve points, and I've only learned probably a small fraction of it. Okay, so that's been a lot of learning for me from now on. But I'm endeavored to do more, because this is definitely an interesting topic. So just want to show you some needles as well, just for interest's sake. So they come in a pack of hundreds, but once again, it's really fine. I don't know whether you can see it. Can you see how thin the needle is? It's so thin that you can't quite focus. But what I can tell you is, just take it from me, they are very small. The plastic bit that you see is actually the guide tube. So you might see a really faint line inside the guide tube. This is the needle. And I must say, when we were practicing, you have to practice on yourself, and it's actually much harder than you think to actively stick a needle in yourself, knowing that you might hurt yourself. But the funny thing is, in quite a few places that we practice on ourselves, especially on the legs, it's relatively painless. I don't even know that a needle has gone in, and you can only feel a pressure because the guide tube is put onto your skin, so you can feel the pressure from the tube, but you don't necessarily feel the needle is going in. So I think acupuncture would be very useful for, let's say, patient who's been on pain control for a long time, on a combination of medication, and the pain is not getting any better, or people who are intolerant to pain control. Quite a lot of people can't take any painkillers because of the side effects, and they do have quite a lot of pain for a long time, affecting their lifestyle and quality of life. And I think, to be honest, as a complementary treatment to usual Western medical treatment, acupuncture is definitely something to think about. As I said, I yet to explore the holistic side of acupuncture, because at the moment I'm concentrating on pain control. But I think once I've mastered the pain control side of acupuncture, I'm more inclined to look into how you can actually treat a person as a whole with acupuncture. But don't get me wrong, obviously I'm trained as a GP, and I totally agree that with any problem you should go and see your GP first, and this acupuncture should only be used, well, at least in this country anyway, should only be used as a complementary medicine when all the dangerous things are ruled out. For example, you don't want to stick some needle into someone's head just because they've got a headache, and you don't do investigation. So I think number one thing is investigation is important to rule out all the dangerous things, and if it's only pain and musculature problem, then I think acupuncture would be very useful. So what I'm gonna do is during the weekend I'm gonna practice on my husband. So lucky him, yeah, so free treatment for him, and I will actually film it and tell you how it actually feels like, and I'll keep you up to date regarding my progress. Alright, so stay tuned, bye!